Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I want to talk about when or how frequently you should be submitting your physical therapy claims for private practice. So we have three basic scenarios. We have should you submit claims daily, weekly, monthly, and as a bonus, at the end I'll talk about submitting claims at the end of the patient plan of care. But real quick, if you don't want to waste any time watching the rest of the video, absolutely best practice is submit your claims on a daily basis. Even if you're a new provider in private practice, even if you have a small caseload, maybe one or two patients, your ideal scenario is to submit your claims the day of treatment or within 24 hours of the date of service. And the reason why is because if you're going to run into problems, if you've got a transposed letter or number in the Medicare member ID or other third-party payer member ID, if you have a diagnosis code that's not a billable diagnosis code or something else that's going on, you want to catch that as quickly as possible. If you're waiting days, weeks, months to submit those claims, it just takes too long before you find those problems. Now, for some of you that are getting busier, maybe you started your practice, you're a mobile therapist, you've got a handful of 5 to 10 active patients, you don't have an administrative team, you don't have any help on the billing and collection side. I know the appeal of just saving that for the end of the week and submitting everything in one shot, one batch. That's doable, but like I said earlier, you run into the concern that if you wait a week to submit a claim, then something happens or goes wrong. It's usually another week or two before you even realize that something is going wrong. Now you're falling almost a month behind identifying where the problems are. But worst case scenario, if you just can't do it, you dedicate 2 or 3 hours on the weekend, and that is when you submit your claims. If you go that route, best practice is submit individual claims for each date of service. And what I mean by that is don't list 2 or 3 dates of service on a single claim form, whether you're submitting electronic or you're submitting via paper. Submit or generate each claim for each date of service and keep them separate. This way, again, if there's a problem somewhere, it's easier to identify when everything is kept separate, clean, discrete. Now, the worst thing you could do is to submit claims on a monthly basis. Because by the time you're at the end of the month, you're getting ready to submit your claims. If there's problems, there's a good chance the patient's already been discharged by that point. It is just too long of a time delay. Medicare, when you're submitting claims electronically, will usually process a claim in about 2 weeks. 12 days to 2 weeks. If you're submitting claims via paper, it could be as much as 30 days for Medicare to process a claim. If you're waiting a month, now we're talking 2 months before the claim is even processed, before you identify any potential problems. So submitting claims monthly, probably the worst thing you could do. And then finally, people will ask, well, what about waiting until the plan of care is complete? So if you evaluate a new patient, you develop a 12-visit plan of care. Should you hold the claims until the end of the plan of care? And just like I've said throughout the video, no, you should be submitting claims as soon as possible, preferably within 24 hours to identify any potential problems, but also to manage your cash flow. You want a steady stream of income. If you're waiting for the plan of care to be completed, you're delaying having that cash in your hand. There is a time value to money. You never know what is going to happen. You never know, heaven forbid, there's a huge public state of emergency and all of a sudden everything gets shut down and you need cash in your hand. So to manage cash flow, to reduce risk, to catch problems, my best advice to you, whether you're a PT, OT, or SLP, or some other form of healthcare provider, is to do your best to submit claims on a daily basis or within 24 hours of the date of service. If you have other questions or want to discuss other topics, go ahead and post them in the comments. Otherwise, please subscribe to support this channel. I'll catch you on the next video.